one of the things I always say about Patients Rising, one of the things I love about this organization is like, if you're looking for something that's like super pristine, super polished, super put together, that's not us. Our shoes are scuffed. We're a little rough around the edges.
Just a little bit.
But that's why everybody loves us, right? So first of all, I didn't know about the picture thing. I'm very sensitive about the fourth chin that I developed. I know the pandemic ended. I know the pandemic ended like 2 years ago, but I haven't stopped eating, so I'm working on getting it under control. Anyway, that's not why we're here today. So I think I mentioned a little bit before that one of our main focuses is around patient empowerment. For obvious reasons, we believe patients should be the primary decisions on what happens with healthcare, right? And I've said this before, it might be new to you guys, but only in healthcare does it require a bureaucrat to sign off on some kind of medical expense or procedure to get it done. It drives me nuts. I know it drives you nuts. And so what we're going to talk a little bit about today is health savings accounts, both sort of what they are and sort of their current state, as well as some public policy that can help make health savings accounts more accessible to more Americans, particularly low-income Americans in the country. So I'm very excited to have with me Brian Blase. Brian is head of the Paragon Institute. He's also a former special assistant to the president on the National Economic Council. He has a Ph.D. behind his name. Should I call you doctor? I know that's the trend. And I also want to introduce Jessica Baladad, who's a 5-year breast cancer patient survivor. Jessica, I'm super impressed by. I'm trying not to steal your whole stories, but in a nutshell, she's one of these people who's taken a diagnosis and really taken it forward in terms of trying to help other people using her platform to improve screening. And in fact, we had a conversation the other day. She has a ton of entrepreneurial ideas that I really think are going to be helpful to patients. But and Jessica, I think I'm going to start off with you because I should say, sorry, we were supposed to have a third panelist, Mark Fendrick from the University of Michigan, the VBID Center. Really, really smart guy. Unfortunately, Mark's mother passed away, and he wasn't able to join us. He was incredibly apologetic. He very much wanted to come, and he would have been a great guest, but that's why Mark isn't here today. So we're sorry for his loss, of course, and we wish the best to his family. But back to the topic at hand. Jessica, you I think, have really good inside knowledge in terms of health savings accounts, and you've personally used it as it relates to your own experience with breast cancer recovery. Would you mind just shedding some light on that?
Sure. So after I went through chemotherapy, I decided to have a double mastectomy, and I get this phone call, and they said, "Hey, you owe, your deductible's $3,500. You need to pay at least $3,500." And I'm like, "Well, I don't have that, but I did have a health savings account with some money on it, and I was able to negotiate that bill, pay what I had on my health savings account, and it took care of it. And I recovered from surgery, everything went well, and I was able to purchase things that helped aid in my recovery and my care."
Thanks. And it's something that you've been able to use for a lot of different reasons, right? I think one of the things that people don't necessarily know is what you're allowed to use an HSA for.
Yeah.
You mind talking a little bit? Yeah,
so I've been able to use it for co-pays, for deductibles, for purchasing medications. I about said drugs, I bought drugs with it. Not quite. But I also have some things that I can show as well. So I've had several surgeries related to reconstruction and whatnot, but so this is, it's been worn obviously, but this is a compression garment that I would wear underneath, I'd wrap it around myself and wear it underneath myself. I was able to wear or purchase, compression garments that I had to wear this for 6 weeks straight. They send you home in one of these each, but I wasn't going to wear the same thing for 6 weeks at a time because also I had to wait 2 weeks to shower. I could only use like wipes and pads and stuff like that. I also, for my post-cancer care, this is called the Aware Pad, and I was able to, so I found a lump in my breast when I was 33 years old by performing a self-exam. And this is called the Aware Pad. I use this in my post-cancer care because I'm still very vigilant about my self-exams and I have to care and take care of myself. And so I'm able to use this to help me perform self-exams. It's got a lubricant on the inside of it that increases the sensitivity of your breast tissue so that you can easier detect lumps, bumps, and abnormalities. Additionally, I'm at a higher risk for colon cancer as well, and this is called the colon disease test. And I was able to purchase this. What you do, you go to the bathroom, you place one of these pads into the toilet, and then you just, if it turns a different color, it can alert you to if there's blood in your stool. I'm also too young to have a colonoscopy. I was also too young to have a mammogram. That's why I believe in self-exams and why they're effective. But I was also able to purchase this and use it, and it helps me take care of myself because then I can go to my doctor who can make an easier case to my insurance company. Hey, we believe that she may have blood in her stool, so she needs a colonoscopy. So I'm able to help take better care of myself after cancer as well. So an HSA has been incredibly helpful to me in purchasing the things, not only during my diagnosis, but in my post-cancer care as well. It's been very important.
Thank you for sharing that.
Mm-hmm.
Brian, HSAs aren't new, but I don't think necessarily a lot of people know about them because not everybody's eligible to have them. Would you mind just giving a little bit of background in terms of where did HSAs come from, as well as who's allowed to take advantage of it today?
Sure. So HSAs have been around for about 2 decades. They were created in legislation that was signed in 2003. But you have to have a specific type of health insurance plan in order for that plan to be HSA qualified and for the individual to make contributions to their HSA or for the individual's employer to make contributions to the HSA. It's called a high deductible health plan, and that plan has to have a minimum deductible, but it also has to have several other requirements, and most health insurance plans don't meet the requirements to be integrated with HSAs. Now, more plans over time are HSA qualified. So the number of people that have HSA plans and the amount of contributions in health savings accounts have grown significantly over the past decade or so.
What about government plans like Medicare, Medicaid, even ACA exchange plans?
So you can't have an HSA if you have Medicare or Medicaid. They don't meet the high deductible health plan requirements. Now, ACA plans, most of them are very high deductible, but not a lot of people that have ACA plans have HSAs. Interesting.
Is there any particular reason why people aren't participating in the HSAs, or?
For the ACA plans?
Yes.
I think it's in part a feature of the subsidy structure and something that we'll get into, but most people that buy ACA plans report that they have low income, so they qualify for large government subsidies. And one of those subsidies reduces the amount of cost sharing. Now, the design is that it's the government sending money directly to the health insurance company for the health insurance company to reduce deductibles and co-payments. But they reduce the deductibles below the point at which somebody could have an HSA plan.
So what type of, from your perspective, I think we heard a little bit about Jessica, how she's been able to use an HSA to help her health care. What type of flexibility do you think it offers patients, whether it's in selecting a plan or also sort of being empowered to use, stretch their financial dollars towards?
Most of health insurance, got a lot louder. Most health insurance expenses most health care is paid through health insurance. There's a lot of inefficiencies with running the vast majority of our healthcare spending through health insurance. Now, health insurance is very important. People should have health insurance. It's there to pay for catastrophic expenses. But when health insurance pays for everything, there's just a lot of administrative costs and burdens associated with that. So what HSAs do is it is the most effective way to empower patients to control the healthcare financing. So it is allowing individuals to keep their money in an account that has significant tax advantages. It actually, the HSA is the most significant tax advantage account that the federal government has created. The contributions are tax-free. The interest and earnings in the HSA grow tax-free, and as long as you make withdrawals for qualified medical expenses, there's no tax on the withdrawal. So the HSAs offer patients a significant one. They align incentives so that patients are focused on getting value from their expenses, but it allows people to keep their own money and spend it on the healthcare services and products that best meet their needs and situations.
Yeah, I think about this, and Jessica, we talked about this a little bit the other day too. Everybody has their own needs in terms of a health insurance plan, right? And some people, may prefer a lower deductible because of a health situation that they're in. Some people may prefer, in fact, a lot of people prefer high deductible plans. And if Mark was here, I think he'd talk a little bit about sort of a combination between high deductible and HSAs is actually incredibly liberating for patients. Because it sort of allows you to sort of sit in the driver's seat. But Jessica, I kind of wanted to talk to you a little bit about this because you're obviously somebody who has a pre-existing condition, and somebody who probably has to be thoughtful about what you're getting in terms of benefit design in your insurance. And I'm sort of curious if you feel like you're overinsured in some areas, underinsured in some areas.
The way that I approach healthcare, I know like when I have a pretty high deductible plan right now, and that's actually helped me negotiate some things, so I'm okay with it. But what I love is having the SHA so that I can pick and choose how I'm going to pay for my health care. I actually, in preparing for this, I asked my social media following on Facebook and Instagram, I posed the question to them. I said, hey, if you had the option, if let's say the government was going to give you money towards health care, would you want to apply to your premium every month, or would you like the freedom? What if it was put on a card for you? I didn't call it an HSA because I didn't think they'd understand what that is. That's a whole other conversation. I said, or if it was put on a card for you every month and you could pick and choose and decide. And I had to go back and clarify. They're like, well, does it expire? Does it roll over? I'm like, it does not expire, and it can roll over year over year. I said, would you choose option A or option B? And out of about 250 responses, only 2 people picked option A.
Oh, really?
Yeah.
Really?
Yeah. So they were very much in favor. And I said, hey, I'm going to do some advocacy work this week. I will come back and explain why I'm asking you this. But they were like, yeah, I want to choose how I use my money. And I want to be, if it's, tax-free and, I'm not going to face a penalty there. That's what they wanted. Because I know as a patient, I like the power to pick and choose. In so many elements of our healthcare and insurance, we don't have those options. We are told where we can go to the doctor, what we have to pay. It's just so convoluted and confusing. It's so easy to pay into, but difficult to understand. And I feel like it was created that way on purpose, and it's not right.
I'm curious, show of hands, who's familiar with a health savings account? Oh, that's a lot of people in the room. That's pretty good.
It's a smart room.
Yeah.
Yeah. How many people actually have access to one?
Ooh.
Fewer. Okay.
Wow.
A lot fewer. That's interesting.
Yeah.
That's interesting. Let's switch gears for a little bit and let's talk a little bit about the Access Act. Brian, it's something that I know is kind of a passion point for you. Can you, I guess, just tee it up in terms of sort of a high-level explanation of what is the Access Act and why is it important for particularly low-income Americans?
Yeah, let me say, so this is exciting for me to have an opportunity to do this because we created this policy 2 years ago. We released a paper through Paragon Health Institute. I have 3 co-authors on the paper, and it's exciting to see an idea sort of come to life and get some traction where we have members of Congress that have introduced it in legislation. The key motivation behind the Access Act and a lot of our thinking in this area is that government is spending an enormous amount of money subsidizing health insurance for low-income individuals. But the money goes directly to health insurance companies or it goes directly to providers. It is not under the patient's control. And insurance companies and providers have different preferences than the individual patient. So what we want to do is develop policies that direct as much of this government subsidization as possible away from insurers and providers and to individual patients. Who have different preferences, different needs, and who we believe are in the best position to make decisions about their healthcare needs. So this is a program that is narrowly focused within the Affordable Care Act. The Affordable Care Act, there are 2 main subsidies for lower income people that buy plans on an Affordable Care Act exchange. One subsidy reduces the amount of premium that people owe for a plan. The second subsidy reduces the amount of cost sharing. This subsidy is a payment from the Treasury to the insurance company that the individual has selected a plan from for that company to reduce deductibles, co-payments, and out-of-pocket limits. Our idea is how about we give these lower income ACA enrollees an option so they can have the subsidy structure work the way it does, or they could take an actuarially equivalent amount of a subsidy into an health savings account or a health savings account-like account so that they have the control and the financing just is directly available to them to use on healthcare that they want.
Thank you for that. I guess one of my questions too is I think, and please correct me if I'm wrong on this, but my sense is, historically speaking, HSAs has sort of been viewed as a tool for the rich, which is why it's not necessarily maybe as prevalent. This completely flips that, right? And so insurance companies will probably not love this, but I guess I'm sort of trying to get the landscape on who's going to take issue with
so when you're on the Hill and you're talking about HSA policy, it is good to be aware that there's a partisan divide around an approach to HSAs. And so President Bush signed the creation of HSAs in 2003, and building on HSAs has long been a Republican health policy priority. Democrats have looked at HSAs more skeptically. Like you mentioned, has a vehicle for high-income individuals to grow and maintain wealth. Now, I don't think that characterization is accurate. I think HSAs primarily benefit middle-income Americans, but this is a policy that does flip that script and empowers the lower-income enrollees. These are people who have income below twice the federal poverty line. So for a single person, it's income below about $30,000. For a family of 4, it's income below about $60,000. So you really are looking at the lower income Americans that would have access to this government contribution into their HSA.
Yeah, and I think that's a great point. And on top of it too, for lawmakers that may not necessarily be familiar with the Access Act, because keep in mind, members of Congress, they're on different committees, they have different interests, priorities. Not everybody's going to be familiar with this. We're educating them. I can assume some will question, well, is this going to undermine the Affordable Care Act? Where I actually think this strengthens it, but I'd be curious in both of your takes.
Yeah, I mean, it's an option, and it's only for people to use that have ACA compliant coverage. So if anything, it should build on and expand enrollment in the ACA, because there's some people for which this HSA option is going to be attractive enough for them to sign up for coverage, and particularly among individuals that are that expect low medical risk, this is a really good option for them to sign up for coverage and get into the risk pool. So I think this builds on the ACA. Again, this is an option for people, so it is not constructed to take away any alternatives that are out there. People can exist under the status quo if they prefer to get this cost-sharing payment to their insurance company for lower deductibles and co-payments. This gives them an option, though, to take it as an HSA contribution that they control.
Yeah, so that's an important point. Number one, it's an option, right? Nobody's obligated to take it if they don't want it. If they want status quo, fine. I think another important point too is you're not necessarily losing any benefits as a result of it either. There's no change to the benefits. It's just simply, rather than funding an insurance company through a subsidy, it's.
And you're right, insurance companies aren't going to like this, right? So it's taking the subsidy away from health insurance companies and giving it to individuals. One of my heuristics has been if insurance companies don't like it, it's probably the right policy to be pursuing.
I was just going to say that's probably general consensus among this audience anyway. But yeah, no, that's one of the reasons why I'm so fired up about this particular aspect of it. There's nothing I love more than fighting with insurance companies. Jessica, I don't know if you wanted to add anything to anything Brian said.
I like fighting insurance companies too.
Yeah, yeah. That's why we're here.
Yeah, so 10 years ago, because of the Affordable Care Act, I was required to have insurance, and I was getting ready to turn 30. I actually knew about breast cancer in my family and was very cognizant of that. And I remember telling myself to stay in the habit of doing my self-exams because I knew that, mammograms generally start to be covered at age 40, and I was 30. I was diagnosed at 33. But I had an ACA healthcare plan because I was required to have it. I did qualify for a subsidy, which they put towards the premium, but I'm like, I'm pretty healthy. I was in the best shape of my life. I was running marathons and lifting weights and everything, and I only had it because I was required to, and I wish I just had some of that power given back to me, because maybe I would have spent it on things that I actually needed for my health care at that time.
One of the things I love about this too that I think is really important to understand is the savings account. You're not obligated to spend everything in a calendar year's time. And one of my greatest frustrations about health insurance is they only focus on the calendar year. So even if you have a chronic illness, I think we all know we have good years and bad years, right? And so there might be some years where, you're having to drain that account more, but you may have some years where you're able to actually roll it forward so that when you do have a catastrophic, event, you're going to have that cushion there to help a lot with the payments. Is that fair to say?
Yeah.
Yeah.
I just want to pause for a second. Is anybody just audience question? Oh yeah, hop in. The cameraman guys are going to be mad because I don't have a mic, but let's see if this.
I don't know if he's pointing at me or something.
Yeah.
I don't know. They'll adjust. They'll get mad at me for it, but it's okay.
So I guess I had one of those, do I have to press something? I'm pretty loud. I had one of those HSAs, or I guess you're calling the rich people because it came from the corporation. Is that what you're saying? Because we always had.
That's the stereotype.
But here's my question, and this is what happened to us as a family trying to use that for a child with a rare disease, is it got held up because where they take care of that is across the hall and they don't speak to each other. And they held it up literally for a $5 copay that we couldn't figure out where it came from. I said, can I just pay the $5? So they lock your account so you can't get into it until you fix that. So my question is, what is happening to the other end? So we have this, I think it's great to have the HSA account, but what happens when you go to use it and you need the reimbursement from your account and they blocked it on you? And that happened to us, and that's when we stopped doing it, because we had thousands of dollars in there being saved up that we wanted to use for his treatments and what have you, and literally $5, and they couldn't tell us what it was from. So it was just this whole cluster, whatever you want to call it.
Just to make sure I understand that. So what I hear you saying is you've had an HSA, you've tried to use it. When you were going to pay for something, basically the account was not open.
Yes.
So I guess, was it like they flagged an expense or?
They just said they were not gonna give you your money, because you can't just go, it's not like a bank account where you can go to the bank. You have to, right, it's an insurance form, just like everything else that you're using, it's a debit card that they give you.
Correct.
And you're not able to use it when you go in to use it, because it's flagged. And you call up and you find out, well, that's because we don't have this information on this, we don't have that information on that specific, I think it was from his treatment, actually. There was a $5 copay, but they didn't even have like any telephone number or any access to it, and you were not allowed to then pay it yourself. It was part of the policy. So that's my question, is how is it gonna work on the back end? Because that's, especially if the government, no offense, but if the government's involved, there's probably all kinds of paperwork. Did you find that you were locked up at all when you tried to use it?
For me?
Yeah, the debit card.
I didn't have those issues. I'm sorry to hear that you had those issues. Mine was pretty easy to use and pretty accessible to me. Mine's also through my husband's employer.
Yeah.
Maybe, I'm trying to think if maybe there was a time that we did struggle to use it, but I don't think so. Like, I've been able to actually use it like a debit card. Like, I've used it at a pharmacy before, to buy some of the things that I talked about, purchasing the medical devices that I needed for my body, I didn't have that issue because
I know,
it was,
it's weird,
yeah.
right? It was literally $5.
Yeah, I would
And-
say go through your employer, the human, or your spouse's employer, whomever it's through, and I would say like someone in human resources would be able to help you with that because they
Yeah,
generally take care of that.
I think it took me, this is my early days of advocacy, and it took me a while, but once that happened, we were afraid to use it because we were putting all
So was
this
this a long time
pre-tax
ago?
money. This was a bunch of years ago.
Yeah, I would say
Probably
that-
like 10 years ago.
I would think technology's gotten better now.
Oh,
and
yeah.
the cards have gotten better.
Yeah.
Like, there needs to be the protection when you use the card that it's gotta be used for a qualified medical service.
Yeah.
You can't use the HSA card on,
But on their
regular.
end, because you have to then, you use it.
But that to me
you have
sounds
to-
like if you couldn't pay in cash, like you should have been able to pay that $5 in cash. If you couldn't pay, that's a problem to the insurance design and the insurance
Yes.
company. That problem is probably there and it's not on the HSA.
Yeah.
It was.
Yeah.
Well, it is, but something else is always involved. You know what I'm saying? So there's a place that does, in Medicaid, right, you can get overrides, but it's a third party you have to go through,
Yeah.
right? So if you're talking about an HSA through a government thing, I'm assuming that's a third party that's gonna handle it. So that's my question, is the third party, what's their policies going to be? And how much of documentation do you need? And what documentation are they collecting so that if there is a discrepancy and you find out about it, of course, like 3 months later, how do you even remember with all the different medical bills you have, if you've got a person with a chronic disease, that you're going to remember which person in your family went where to clear this up by yourself, because you have the account, it's yours now. So that's my only question, and that, like I said, for $5 was like the most horrible thing I could possibly think happened, and that's when we decided it wasn't worth putting the money in, because if you can't have access to it exactly when you need it because of some trip up someplace, then it wasn't. But I'm sure that now that we spoke about it, you'll make sure that does not happen.
Well, no, I'm glad you flagged that, and I think Brian's right too. There has been, because I remember HSAs, shortly after 2003 and stuff like that. Like you used to have to like manually submit receipts and stuff like that. And it's improved a lot, but
Yeah.
I think you also highlight. Listen, it would not shock me. And Brian, I'd love to get your take on this too. Like, it would not shock me if CVS, for example, positions some kind of barrier to use, not because you can't use it, just to be a pain in the butt. Let's be honest. But yeah, I think it's a good question. Like, government's not always great at plans,
Executing plans.
And so I do think it's a good question about how this is sort of administered on the government side for patients. Just the kind of the mechanics of it.
I mean, what we have in the HSA option, the government would not the government doesn't have a role. It would be there'd be a requirement on the debit card, so the bank that is issuing the debit card needs to design it so that you can't use it for expenses that aren't qualified medical expenses. And the technology has gotten to the point where my understanding is that's pretty easy to do.
And how do you find out what's qualified and what's not? I mean, if it's your money, you should be able to spend it on anything healthcare for you.
The question for the cameras is how do you know what's a qualified expense and what's not?
So I'm sympathetic to your last point, but there are rules, and if it's going to be a subsidy for healthcare, like if we're taking this money and saying people need to use it for, like the government's going to make a commitment to spend this amount of money on people's healthcare, but we're going to give it to the individual, there needs to be the safeguard to get that through the Congress that the money is going to go through healthcare. There's a list of qualified medical expenses. She went through all of the items that were part of that list. I mean, most services that you would get from a physician, devices, pharmaceuticals, are going to be covered by that list.
Yeah, and I think most of us are sympathetic to the point in terms of it's your money, you should be empowered to use it. But correct me if I'm wrong, Brian, I think part of the reason for the guardrails is to avoid some fraud, things like that. There could be abuse of the program.
Correct.
Sure, yeah.
So I work in pharmacy. I've had people come up to me to cash out, and they would bring out everything together, and they would use the HSA first. It would take off what's qualified and leave the remainder. So I was expecting the same when I went to cash out with an HSA, and it covered things that shouldn't have been covered. So would there be a penalty for somebody purchasing something that isn't covered and they don't know?
Technically, yes, but I don't know how that that would be very difficult to enforce and
Okay.
catch. Yeah.
Okay.
But the card should, I mean, theoretically, the card should catch that.
Is it on the card or is it in the store? Because when I used to add items in our system when I worked at Walmart, when I did that, it would be like, well, is this item WIC eligible? And we would choose that when we add it. And these would be prescription drugs, so obviously we'd.
I would expect the burden is on the card and not the store. But
Okay.
It's a good question.
Yeah. Carol?
Yeah, so I had a great experience with an HSA a few years ago, really excellent. But now I'm old and I'm on Medicare. But our organization supports a lot of patients. So I did have a question about access and how this kind of insurance works. If a patient is denied access for something, for an out-of-pocket or an insurance-denied expense, can they fight that through this insurance company, or they just go into the HSA savings to then go ahead and pay for the services or the medications or whatever was denied through the regular channels, if that makes sense?
It's a really good question. Actually, one of the points I wanted to make on the HSA option, so the trade that you take for taking this amount of money is your plan would have a higher deductible and higher co-payments. But the ACA plans only apply, the deductible and co-payments only apply to in-network providers. And one of the main observations about ACA plans is that they tend to be narrow network HMOs. So most of the best hospitals and doctors in regions don't take ACA coverage. So those lower deductibles and co-payments don't mean anything if you can't if you don't, the doctor that you want is not in that network. So the HSA allows you to use that expense on in-network or out-of-network. Now you could still fight with your insurance company, and you could see if that, if you're successful on getting them to cover services that you think they should cover, but they're saying they don't have a responsibility to cover. But if the insurance company doesn't cover it, if it's an out-of-network service, you could use your HSA on that service. That's one of the big benefits of this option.
Yeah.
So
I
one,
was,
go ahead, please.
Oh,
Two
I was-
questions after you're done. Go ahead.
because I was going to say, some of my friends who are at high risk for breast cancer and they're under the age of 40 and they're not able to get their mammograms or screenings covered, they're able to go to a screening facility with their SHA card. The facility only cares that it's covered, right? They because if the insurance isn't going to cover it, they generally don't want to screen you without a referral. And it's not a one-size-fits-all with this. I'm just speaking very generally here. But many facilities are like, hey, you know, if you can pay for it out of pocket, we're going to cover it. So many of my friends, you know, I'm asking, when they ask Jessica, how do I get screened? Where do I get the liquidity to get screened? I'm like, well, do you have an HSA account? And I'm going through them, you know, many of them didn't even realize that's what they had through their employers or their spouse's employers. So it's been really beneficial for them to get those screenings and use their SHA card towards those. Mm-hmm.
Michael, go ahead.
All right, two questions. One, briefly, you want to talk about the difference between an HSA and an FSA, because my insurance company only allows FSAs, which you have to spend within a year. Second question is why do you feel that the HSAs are necessary for Medicare patients?
So you hit on one of the main differences between the HSA and the FSA. So there's also something called the HRA, the Health Reimbursement Arrangement. The FSA and the HRA are employer accounts. And for the FSA, there's a lot of inefficiencies because you have to estimate the amount that you want at the beginning of the year. And if you overestimate, then at the end of the year, you're buying braces for your kids, whether they need braces or not. That was my experience when I had an FSA, right? So you engage in a lot of wasteful spending at the end of the year because the amounts don't roll over from one year to the next. The great thing about the HSA is that money, whether the employer puts it in there or it's your contribution, that is with you, that stays with you until you make an expenditure from the HSA. So it's under the control of the individual with rollovers. Remind me your second question.
Why do you think that you need an HSA or this bill for Medicare patients?
Because
Not for Medicare, for...
So the HSA option is for the ACA population, so not the Medicare population. But I certainly support Medicare enrollees having access to HSAs and that they should have the ability to invest.
My question is why? I mean, I understand the ACA folks, but why Medicare folks?
Why don't they have it?
Why would you recommend that it be rolled to them too?
I was going to say, like, for breast cancer, like, some of the things that I showed aren't automatically covered by insurance. So you can use an HSA card for some of the devices and the things for lymphedema, for just the different, like, the pads and the stuff, the compression and things like that may not be covered, you know, through Medicare itself. You know, that SHA could help someone on Medicare buy those extra things that they need for their care.
So Paragon has two main recommendations on HSAs. We talked about the one, which is the HSA option. The other is to dramatically increase the plans that could be integrated with an HSA. And that applies to the Medicaid population, the Medicare population, the commercially insured. And I think you know, this is sort of the first step to see if we can get a government contribution into an HSA-like account. And we think this is the low-hanging fruit. But assuming we get this through, then we want to build on it to, you know, transition a portion of Medicare spends a lot of money too. How about we take some of the Medicare spending and direct it to individuals and put it directly under their control? Same thing with Medicaid.
So we're going to do one last audience question. We're going to come back to the audience, but I got a couple other things. So one last question, then we'll... Wait, not you, Terry. What, do you think you run this program? Come on.
I'll comment later. Go ahead.
So my concern is, does this sort of incentivize then the insurance company to just increase denial rates? Because they can then say, well, the patient has the money, it's on the HSA card, they can do whatever they want, we don't have to pay for it. That would be my concern, just knowing how insurance likes to deny already. How would we put like a safeguard, I'm guessing would be?
Yeah, I mean, the insurance company needs to pay for services that it's legally obligated to pay for, right? So does it make some prior authorization more stringent? Potentially. That's not something that I have thought through. It's a good question.
Yeah, I mean, I personally think, just knowing insurance companies, there probably will be sort of a counter reaction to that. I also think, and this is sort of separate from the Access Act, but I think we're really exploring, and Brian, you may have some thoughts on this too, but we're really exploring how we can create greater competition among insurance companies within states in the exchange, because right now, let's be honest, like I don't know, every state's a little bit different, but I know most states basically have two options, right? And so, how can you start to get options that are a little bit more tailor-made to you? But also, if you're going towards a more high deductible plan with the HSA, frankly, there may be fewer restrictions because more is going to be on you anyway, right? Financially, I think. So one thing I wanted to talk about, because at the beginning when I sort of, hold on, darling. As I was sort of talking about, kind of the organization and where we're kind of focused. And like I said, we don't want to position ourselves extreme right. We don't want to position ourselves extreme left. We want to really build sort of a center-right, center-left coalition of patients, and we want to focus on patient-inspired policies. I am not going to speak for members of Congress when I make this comment. I can honestly see reasons why both congressional Republicans and congressional Democrats would not be a fan of this. I can make arguments for it. I can come up with reasons why congressional Republicans and congressional Democrats would be in favor of this as well. But I think the great thing is we have some polling data as it relates to this particular thing. It's widely popular among the public. First of all, the general public does not believe low-income Americans are getting the same type of health care or the health care that they deserve. And having this HSA option for low-income Americans is wildly popular. What's even crazier is when you break it down by political party, and I don't have the numbers in front of me, but so bear with me on this, but I would say it's roughly 80% favorable among Republican voters. Again, I'm not talking members of Congress, voters. It's close to 90% among Democrats. So this is something that's beyond bipartisan, right? From a human perspective. Not talking about Congress, because they're weird, right? They're weird. They make things hard unnecessarily. But I think that should give you guys a lot of confidence when we're going into these rooms. I don't really care about the party that the member of Congress is coming from and what's kind of influencing their opinion. You should all know this is wildly popular among the American public, okay? Jessica, Brian, I don't know if you have anything to add on to sort of the popularity of the poll numbers.
I mean, like I said, I polled my own social media following, and they were very much in favor of like I said, I didn't call it an HSA, but they were in favor of the idea of having more control of the money, something that rolled over, something that wouldn't expire, something that that just empowered them to make better choices for their health care. So,
I'd say a lot of the reasons the health policy looks the way it does is because of paternalism. And one of the powerful things that I think you could say is that patients should be trusted, that they're in the best position possible to make decisions for the health care that they need, that we don't need bureaucracies in Washington and at insurance companies in charge of our health care system.
Yeah, thank you. Brent, why is now the right time for the Access Act?
So it is next year is going to be a big year for Congress on the legislative front. There's a lot of fiscal policy that is expiring after 2025, including a lot of the Trump tax cuts expire after 2025. There's also a enhancement to the ACA premium subsidy that expires after 2025. So there's going to be a big legislative package in 2025 that will probably touch on healthcare. And what we want to do, you never sort of know what the makeup of that legislative package is going to be, But what we want to do with this HSA policy is get it on the radar of some of the key policymakers and key politicians that will be part of the conversations next year. So the extent that this becomes one of the, a major priority for one of the key members of Congress in how they want to change health policy next year, then they will bring it into the negotiating room. And then it's got a chance to become law.
So the debate's coming. And
Yes.
it's a matter of how we contribute to it, which is, let's be realistic. This is probably not a bill that passes in 2024.
It is not a bill
maybe it
that's going to
does.
pass in 2024. But next year, and for Republicans, like one of the things that we are at Paragon is thinking through is how to improve the efficiency of the overall ACA subsidies. And we've got a bunch of ideas, but this is one of the central ideas that we're going to be pushing, is to give people, the lower income people, an option to take the subsidy.
Yeah, so basically, this is not something at the end of 2024, when this Congress ends, that we're going to be disappointed that it didn't pass. We understand the dynamics of Congress. We know we're entering a debate in 2025, and we're starting to seed the idea for the future. Everybody follows along with that, right? Let's go back. Yeah, Darlene.
So I have two questions really quick. Would this be, so question number one, would this be a choice that the individuals have between using the ACA insurance availability or having the HSA option, or it's with? It would be both.
You get an ACA plan either way. The question is, do you get the lower deductible and cost sharing, or do you get the HSA contribution?
Okay, because I think that may be asked tomorrow
Yeah.
when we talk about it. And then the other things, will they also get the tax breaks when they do their tax return at the end of the year?
Yes.
Awesome.
Yeah, the same premium subsidy would apply. So there's two subsidies. There's a subsidy that reduces premiums.
Right.
It's called the premium tax credit. That is unaffected by this policy. It is a second subsidy called the cost sharing reduction program. That is where we would give people an option to take an actuarially equivalent amount as an HSA rather than the current design of the cost sharing reduction program.
Okay, so if they were in the position to put their own money in, because like everyone who has an HSA now, if you put your own money in, or even depending on how your employer does it, you get a tax break on that. Would they be able to do that also?
You
So
could,
pretty much the same
you could,
rules.
yes, you could add on to the HSA, to the government's contribution. For the lower income enrollees, the government contribution would be a little more than $2,000, and the maximum amount that you could put in the HSA is a little under $4,000. So they could contribute up to the maximum with their own money too.
Okay, cool.
That's good questions.
Thank you very much.
Go.
Oh, I have a question.
Oh, all right, go ahead.
Okay. Thank you, Brian, for your ideas, and thank you, Jessica, for telling your story, and MacKay for moderating. My wife and I, we decided to live in a lower income area, and we've noticed that a lot of our neighbors are lower income families. And what kind of implements are you expecting to have for helping those individuals make the best decisions for using their HSAs when they're already having to make these decisions of, paying for food and, clothing for their children? Why are we encouraging them, or how are you going to encourage them to use their money the right way? And if they're already starting to take, $200 a month out of their paychecks already, at the end of the year, are they going to be limited to how they actually use these funds to pay for medical bills, things like that?
Can I talk about?
Like, how would you bet? Is there going to be a secondary system that's going to help educate
AI.
these individuals
Is that okay?
in making the best decisions?
Let's let Brian go. And then we'll
It's a good question, and I think, so if you look at the HSA option, we talk about some education that we would require for the insurers that offer the HSA qualified plans, that they'd have to make available about the coverage and what you could use an HSA for.
I've also, I'll let Jessica go in a second, but I've I sort of have been looking for kind of a comparable as well. And it's not necessarily a perfect comparable, but you know, a lot of the population that we're talking about are going to be used to using SNAP, which is, you know, similar debit style card as well, that, you know, is also going to have some restrictions on it. And I think, you know, in terms of making decisions, this policy alone is not going to, you know, change people's minds in terms of, certain health habits. But I do think the point is, when they're having medical issues, when they're having medical crises, when they're even just going to the pharmacy for, you know, maybe it's routine expenses, they're going to have that financial flexibility that they may not take advantage of otherwise, right? Jessica, I know you're working on a number of ideas. I mentioned she's also an entrepreneur as well. So.
Yeah. So I've told my story. I found a lump while performing a self-exam. I created an app called Feel for Your Life that shows you how to perform a self-exam, track your progress, and set monthly reminders. There's also an AI component in there. I've become obsessed with AI since it's really came out and become popular. As it sits right now, there's an AI component that lets you take your pathology report, put it into the app, and it'll translate it into terms that you understand. And give you questions to ask your doctor. What I'm currently trying to do right now is to use AI, where you can take pictures of your medical bills, take pictures of, you know, your insurance, your EOBs and whatnot, and put it into the app, and it's going to help you negotiate your medical bills better and find discrepancies between where your health insurance denied something, and make it easier for you to appeal those and win your appeals. So that's just something I'm working on the patient side.
One other thing, we're going to have a panel on charity care a little bit later, which I will also be moderating. I'd love for you to ask that question again. I think there's, yeah.
Yeah, I'm pretty loud. I'll speak up. I was kind of curious, thinking really about the meetings tomorrow on the Hill. You mentioned earlier, of course, health insurance companies are going to lose that subsidy to go towards the HSAs. I think everybody's on board with that. But you also mentioned providers being affected by that. I'm curious if you have information on how exactly or how large that impact is going to be, and what we, you know, if that comes up in meetings, what are those key talking points that you think we should stick to, of like, here's the correct, I know I read in the paper that the CBO score is excellent. I mean, the 30 billion deficit reduction in the next 10 years, especially with Republican members, that's always a good selling point when you're meeting with them. But I'm curious if you have other talking points that you think, if they bring up, their constituents are also providers and health insurance companies too, so what's the best?
Time out. We have the smartest advocates around. This guy's talking about CBO scores. I mean, this is unbelievable.
So let me, two answers. The second one, I want to talk about the CBO score. For providers, it's really a question of, I mean, I don't know how big the effect is going to be, right? It depends on what the uptake is of the option. But it is sort of getting paid through the insurance company or getting paid directly through the individual from an HSA. And they probably have concerns about both of those. So it's like balancing the provider's concerns on both of those. On the CBO score, so this gets a little wonky, so I'm going to try to simplify this. I've talked about this CSR program. In 2017, a court ruled that the Obama administration there was not a congressional appropriation for the CSR program. So they stopped making the CSR payments in the Trump administration. What that did was cause health insurers to increase premiums to pay for this subsidy going away. The premium subsidy is a function of that premium. So the premium subsidies soared because of that. The HSA option, we would couple it with an appropriation for the CSR program. Insurers still have an obligation on the CSR program. So even though the government payment has gone away, insurers still have to reduce deductibles and co-payments for lower income enrollees. But we couple the HSA option, which is what we have talked about, with an appropriation to the CSRs. What that appropriation would do is cause the premiums to go down, which causes the premium subsidies to go down. So that's why there's a $30 billion savings. It's because of the combination of the CSR appropriation and the HSA option.
Is the provider concern, is that because of the narrow networks and basically the contracts between the insurance companies and the
It should be. I mean, it's not that complicated for the providers to get money from the HSA card, right? The person just uses their HSA card. So I would think that providers are not going to, if anything, they would probably be mildly supportive of reform.
I was thinking the same thing because it basically empowers you to pick the doctor you want to see rather than what the insurance company wants you to see. That may cost a little bit more because of the.
But sometimes providers complain about having to get co-payments from
right.
individuals, right?
Yeah.
So,
I didn't mean to drag us into the weeds. Maybe what is a CBO score in case anybody is wondering that question? Just a brief high level.
You should moderate this panel. Brian, what's a CBO score?
So CBO and the folks that you meet with will know CBO sort of dominates their life because they have members of Congress have lots of ideas, but CBO is sort of the reality check on what the cost of those ideas is. So CBO is the Congressional Budget Office, and it scores all legislative ideas. Primarily for the impact on the deficit. So it is unusual for us to be presenting a policy which is really an expansion of subsidies, right? It's allowing people to use this subsidy under their control in a way that also reduces the deficit per CBO.
Yeah, and I wanted to just take on the question too about, okay, insurance companies, AMA, they hire lobbyists, and they're big voices in the room. In reality, I don't care what they say because the only thing that matters is why you think this is the right decision for patients and based on your personal experience. I'm saying that to everybody in the room, right? Everybody, even if this subsidy, even if this option is not going to benefit from you, I think you can relate to it in a personal way because everybody has access and affordability issues because of health insurance. And this is about giving people flexibility. It's empowering people to make the right decisions. And so I'd be a little less worried about, listen, the insurance companies they're not going to like it. Most things we do, the insurance companies don't like, right? Well, that's fine, right? And the reason we're going to win is because of the voice that you have, the voice that you provide. So we're going to wrap up. Okay, we'll do a couple more questions.
I have two quick questions. The first one is really easy. Is there anything in the Senate or any discussion in the Senate to have kind of corresponding bills related to the Access Act?
Not yet. We are working on that actively. We obviously want it to be a bipartisan bill. We believe that this fly-in and bringing people to educate both the House and the Senate is going to be kind of key to getting people comfortable with that. So not just yet, work in progress. Brian, I don't know if you have anything to add to that, but yeah. Okay.
All right, and then my second question kind of ties into one of the earlier questions with kind of the thought of maybe insurance companies kind of retaliating against the patients and not necessarily covering things later on. Since we're already drawing from kind of this pool of existing money with this subsidiary that's already existing, and we're not creating kind of new banks of money to give to these lower income families, is there any concern that, when it comes to what those subsidies had previously covered and things like that, that just as a whole insurance is going to say, we're going to start to slowly, raise premiums or things like that, or kind of do their own work to make it so that kind of healthcare just as a whole then becomes, more expensive, for these families because now they're going, kind of similar along that line, but, you've got access to these subsidies now, you're choosing to raise premiums. We can kind of just raise the cost of everything. We're not going to deny you coverage, but we're just going to make everything a little bit more expensive. Is there kind of that concern, and is there protections that are going to be put into place to keep them from being able to do that?
So there's the requirements on the ACA plans, right? They would apply regardless. So they need to cover a certain amount of benefits. They've got to cover all preventative cost sharing or preventative services without cost sharing. Those provisions would all continue to apply. What you often hear, which I think is an invalid concern from insurers based on decades of evidence, but they continue to say, is that any policies like this will segregate the risk pool and create adverse selection. So it'll just be healthy people that select the HSA option, leaving sick people in the regular plans, and there'll be an effect on premiums. That they raise that a lot whenever you give people, for any policies that would give people options, and the evidence is that it never happens.
And I think they're going to raise premiums no matter what. Let's just be, I always love the premium argument. When does it ever go down?
Mine is less of a question and just a statement about all of this and having an HSA. So I've had an HSA for a decade now, at least, longer. But I also have a high deductible plan. I have my HSA through the employer, but I have an $11,000 deductible every year that has to be met. So I look at the HSA as a different way of spending, especially having multiple chronic conditions and a rare disease and so forth. You could use the HSA as a way of when you get a prior auth or something and you got to now wait 6 months for it to go through that prior auth. I've used my HSA last year, for example. They found a spot that they wanted to investigate. Doctor wanted to do surgery. My deductible is $11,000. I don't have $11,000 just sitting around to have that surgery, but could I wait 6 months till the prior auth went through to get that surgery? No. I used what was sitting in my HSA account to make that determination that I could have that surgery now instead of waiting. So a lot of times you can use it to cover, I think an HSA is a great thing for that, to cover that deductible, whether you have a $4,000 deductible or a $10,000 deductible. It could be you use it while you're waiting for that prior auth.
As an excellent testimonial. I highly encourage you to see Rachel Adams in the back. We would love to capture that on video. No, seriously, thank you for that story. That was really great. So we're running up on time. Let's just do last thoughts. Let's Jessica, we'll start with you.
I am in favor of using the subsidy to split between the premium and the HSA, or if there's something where you could just use it all towards the SHA. I've benefited greatly. You've heard me share my story and talk about those things, especially. I'm just going to emphasize again, screening, insurance companies don't cover screenings. They're not required to cover them until the age of 40. But every year, 12,000 women under the age of 40 will be diagnosed with breast cancer. That was me almost 6 years ago in 2018 when I was 33. So do your self-exams. That's what saved my life. And just remember, it just gives you so much freedom and power to pick and choose whether it's a doctor you want to see, a scan that you want to get, or if you have to buy devices or things like for your body. And like I said, the things I showed you that helped me take care of myself after cancer have just benefited me greatly. So I see some really incredible things that are going to come from this.
Brian, final thoughts?
Yeah, I'll just go back to what I said at the beginning. Government is spending enormous amounts of money subsidizing health insurance. There's so many inefficiencies from that. I think you are in a powerful position to go to the Hill tomorrow and say, look, patients are in the best position possible. They want to be in control of their healthcare decisions, and they should have an option to take a portion of all of this government spending under their control to use it on the healthcare that best fits their needs.
Great. Thank you so much. Oh, Terry, please. I'm sorry.
In your package, when you look at this, hey, let me find it. So we did this really great thing, because this is a partisan bill on its face, because it's just got Republican sponsors right now, right? But we have this little QR code that you can point out in the corner in your meeting, and that will take them to the poll. So if you're meeting with the Dem office, you can tell them, go here and you can look at the data. Oh, I think I have this one. I think I have it. Thank you. Anyway, I just wanted to point that out. That's what that QR code is. It goes straight to the poll that was done. And it'll, you can share that with them if you're in an office. So, just so you know.
Great. And real quick, just because I know, Brian, if people want to learn more about you and Paragon.
Yes. Which I'm sure you do after this presentation. So ParagonInstitute.org. We just revamped our website a couple months ago, so it's very user-friendly, a lot of educational material on the website, as well as all of the policy work that Paragon has done since we formed just about 2.5 years ago.
Great. And Jessica?
Yeah, if you want to learn about what I'm doing in my advocacy work, you can go to feelforyourlife.com. I'm also very active on LinkedIn under Jessica Baladad. My name's spelled up there. And, but yeah, you can download the app. It is absolutely free to use. Even the AI tool that you can use to put your pathology reports into to translate them for your next doctor's appointment and things like that, but feelforyourlife.com.
Can I say one other thing? So we send out a newsletter every Wednesday. If you want to sign up for that newsletter, you can do that on our website, or you could hand me your card on my way out, and I can sign you up for the newsletter.
Patients Rising. We love patient-inspired health policy and shameless self-promotion. So thank you to our panel, honestly, and thank you for being a great audience.